the VA and Medicare are paying, it's really becoming difficult for me to attract staff, to retain staff. And, you know, we want to provide these services. It's just a question of whether we can afford to. And the squeeze is really getting difficult. And you know this, I'm just here to testify the same thing that other people are saying. We want people to have access to care, and we want to provide care. Please help. Thank
Absolutely.
you for listening, and have a good night.
Yes, thank you. Thank you very much. Okay, Representative Gilchrist.
All
I'm gonna
right.
pass this back to you.
Thank you. Is Heather George with us? How about Giselle Nino? Oh, we did them. Tom. Oh, we did those. I'm sorry. That was okay. That was Jill. Okay. So 111. Carol Rios. Danelli Santos. Monica Nugent. Cameron English. Jean Mills. Go right ahead.
Sorry, forgot how to unmute. Good evening. I'm glad I'm not saying good morning. I'm Jean Mills and I'm an elder law attorney with Connecticut Legal Services. I've submitted written testimony, so I'll try to go quickly and just hit the highlights, and hopefully you'll read my testimony. I'm submitting this testimony on behalf of all three of Connecticut's legal aid programs and our low-income and elderly and disabled clients, who include former and current SNAP recipients and residents of nursing homes. First, I'd like to testify in favor of Senate Bill 497, an act protecting food security for veterans and others and mitigating federal cuts to nutritional assistance. Last year, 12% of Connecticut households, 450,110 of our neighbors, used SNAP benefits. Also last year, President Trump signed H.R. 1, which enacted extreme changes and cuts to SNAP. Eligibility was tightened and work requirements were expanded, affecting millions of Americans and, according to DSS, approximately 36,000 residents of Connecticut who could lose SNAP benefits. Some of them already have. It's absolutely clear that a lot of Connecticut residents in all parts of the states are going to be hungrier and less healthy as a result of these federal reductions in SNAP. SB 497 offers a way to protect food security for veterans and others and to mitigate federal cuts to SNAP assistance. This is the kind of help Connecticut's food insecure residents need. Veterans are specifically exempted from work requirements under this bill. Many of the other impacted groups of people under the federal SNAP cuts, called vulnerable persons in the bill, will be eligible to receive assistance to include benefits of at least $194 per month for up to a year, access to job training, and a case management to help document compliance with work requirements or eligibility for federal exemptions to work requirements. We suggest that an adult who is a caretaker for a child between the ages of 14 and 18 be added to Section 4D of Senate Bill 497, as these individuals were fully exempted from work requirements prior to H.R. 1 and should continue to be. We also believe that the time limit, the 12-month time limit for assistance, especially for caretakers and the asylee and refugee population, should be removed, as those groups may have barriers to working that may not be addressed by access to job training and case management services. Also in this bill, there is Section 7, which is a plan to initiate a food as medicine program under Medicaid for Connecticut, which would be another source of nutritious food for individuals and families in need. And we also support Section 8, which adds an annual cost of living adjustment to Meals on Wheels providers, serving participants in the Connecticut Home Care Program for the elderly. Senate Bill 497 is a good bill, and we support its passage. I'd also like to speak briefly on Senate Bill 481, an act establishing financial safeguards for private equity ownership of nursing homes and prohibited required arbitration agreements. We strongly support Senate Bill 481. I've testified the past few years on similar bills with respect to private equity in nursing homes. It's well known that private equity companies exist to earn money for their investors. They're increasingly investing in nursing homes, and their investment strategy is often incompatible with the nursing home's responsibility to provide good staffing and quality care to nursing home residents. There's the section 1 of the bill requires every nursing home to provide the following extensive information to the Commissioner of DSS annually. And this transparency requirement is well backed up by a provision which allows the commissioner to impose a penalty of $1,000 per day on any nursing home which fails to provide such information. This protects residents against sudden closure or lack of funding for staff.
Please
The proposed-
summarize.
Sure. The proposed statute also provides that no one can sell a property within 5 years of acquisition of it, which is to prevent the usual flipping of property that we know private equity firms do. Other states have done this, New York, Massachusetts, and New Jersey, and I've cited to those laws in my testimony. And lastly, Section 2 prohibits nursing homes from requiring that a resident or prospective resident sign an arbitration agreement as a condition of admission or continued care. And this is a strong protection for nursing home residents who may have a complaint against a facility, for example, for poor care. So we strongly support the passage of Senate Bill 481 as well. Thank you so much for your time, and I'll answer any questions.
Thank you so much. I don't see any questions. We so appreciate your testimony. Have a great evening.
Thank you.
Thank you. Next is Caleb Rosmi.
Hello. I want to thank you all for this opportunity to talk. Distinguished members of the Appropriation Committee, my name is Caleb Rosme, and I serve as the chair for the Home Care Committee. And I am a board member as well of the Connecticut Association for Healthcare at Home. And I am also the CEO of Assured Quality Home Care, and I'm here today in strong support of HB 5561. Exactly 1 year ago, and actually a month ago as well, I submitted testimony describing the industry being at its breaking point. Today, the pressure has only intensified, and when you adjust for inflation, our Medicaid reimbursement rates are currently underfunded by over 50% compared to our 2007 levels. Agencies are not just pass through for wages. We manage the essential infrastructure that the state relies on. We have to carry payroll taxes, workers' comp, provide training, and 24/7 backup coverage for our caregivers who provide care for the vulnerable, elderly and vulnerable in the community. We are required to operate legally and responsible, and yet currently the state's reimbursements do not reflect these fully burdened costs, especially compared to our neighbors. Our agency as well operates in Rhode Island, and the reimbursement rates for home care services in Rhode Island is well over $42 an hour compared to Connecticut, which is closer to 28. There is, no longer any projection. This is the reality. Agencies are now forced to turn away Medicaid referrals or limit the service areas just to survive. When we cannot provide home care services, these individuals don't disappear. They move into a far more expensive institutional settings. And this shift doesn't save money. It increases the state's Medicaid expenses. So in closing, we're not asking for expansion. We're just asking for alignment and that we get a meaningful rate increase. We're glad and thankful for what you've already put in the bill. And we're just asking that you continue through and implement that for the good of home care and for the good of the industry.
Thank you so much. Yes, Representative Vale.
Yes, good evening. I just want to thank you for being patient and sticking with us throughout the night, and appreciate your testimony. Thank you.
My pleasure. Thank you.
Thank you so much. Have a great evening. Next up is Cheryl and Kemye Fortson. Cheryl, if you're there, you just have to unmute, please.
Hello?
Yep, now we can hear you.
Okay, hello. I'm sorry. My apologies. My mom took her night meds. She has to go to bed. So I'm going to read her testimony, if that's okay with y'all. And I appreciate y'all listening and taking the time out to hear us.
Appreciate you. Go right ahead.
Okay. Good morning, Senator Lesser, Representative Gilchrist, and distinguished members of the Human Services Committee. Her name is Cheryl Fortson, and she is my consumer, who has used me as a personal care attendant, sitting here with her, with me. We both are here to urge you to put full support behind Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. A bill that is beyond important and personal to both of us. Me, which is my name is Kimi Fortune Sr., has been my mom's PCA for 11 years. It's a different routine for a parent initially to have their child being their caretaker. We watch them grow and we know we'll always want to care and protect them. But when the day comes that changes our roles, I know there is no one in the world I'd rather care for me than my son, which is me. Hold on. Our set up was great. Me, Kimi, knew my needs was there when I needed care and knew when to give my space to take care of myself. Unfortunately, this past June, I made a mistake that proved to be detrimental for my son more than anyone. I missed a notification to file my redetermination, a simple notification that brought a lifetime of change for me, her son, and herself. It led to the suspension of her Medicaid waiver program, the very program that provides me with my paycheck. Meanwhile, me, Kimi, kept working my normal hours. Neither of us knew anything was wrong until the next week when he didn't get his paycheck, which is me. Kimi called GT Independence, who told him they didn't know why or couldn't provide me with information, and they would often point the blame to DDS. So me called DDS, expected to get some answers. Instead, they directed me to the Department again of Aging. And then it was finger pointing back and forth. The whole time, I still provided my care and still provided my care with no pay for a single hour. It wasn't until November that DDS finally shared the payment issue was all tied to the need to file redetermination. 6 months of payment issues, aggravation, humiliation, and moreover, the simple redetermination that DDS could have informed me of during the first phone call. Instead, they
Summarize.
left. Hello?
Yep. Can you just please summarize? The 3 minutes have run out.
Okay. Basically, there's finger pointing, like when I was there earlier. There's a two-pronged problem. DDS and GTI. They're both pointing fingers at each other. There's no reason that we should have to work and not get paid because they don't work and get paid. That's not fair to us as individuals and as family members. Because when I don't get paid, my whole family loses out because I take care of my family as I'm supposed to, as a person, as a leader, as a parent. And when they reject us and just throw us to the side, that's not fair to us because we all suffer, but they get paid.
Agreed.
At GT Independent, when they were first hired, their value was 35 million. Now, after 1 year of taking our contract, they're up to 75 million.
Thank you so much for your testimony. We really appreciate it. And thanks for being here tonight and taking care of your mom.
Oh,
Have a-
I appreciate you and I thank y'all for listening to us and taking your time to wait here for us. And I appreciate it. Thank you.
Thank you. Have a great evening.
You too.
Next is Lyndon Pitter.
Good evening, Representative Gilchrist and honorable members of the Human Services Committee. Thank you for allowing me to testify. My name is Lyndon Pitter. I live in West Hartford and I have been a personal care attendant for over 10 years, caring for my brother-in-law. I am here to ask you to support Senate Bill 498, an act protecting paycheck for personal care attendant. I want you to picture this. A young man with autism, his family is new to this country, immigrants facing their own struggles and unable to provide 24-hour care he needs. As their son-in-law, I made a life-changing decision. I gave up my career, my benefits, and my financial security to care for him. Today, he is thriving. But that has come with a cost. I earn a near poverty wage and I have no retirement saving. And it is often feels like the system is punishing those of us who choose to care for our loved ones. And I am one of the lucky ones because I have not experienced the payroll issues that so many of my fellow PCAs have faced. Since November, there has been over 3,000 grievances filed due to late or incorrect paid by GTI. This means that thousands of moments where caregivers already living paycheck to paycheck are pushed into crisis. A missed paycheck can mean not paying rent, utilities, or even putting food on the table. 2/3 of PCAs are people of color, and about 1/3 are immigrants. This is not just all about payroll issue. This is an issue of racial justice, economic justice, and disability rights. Senate Bill 498 offers real solutions. It would increase transparency and accountability, evaluate more reliable system of options, expand access to healthcare coverage, and ensure compensation when workers are harmed by late pay. Caregivers deserve stability too. Every day I ask myself, where is the value placed on those of us who care for the most vulnerable? When caregivers are unstable, the entire care system becomes unstable. We should not have to choose between caring for our loved ones and securing our own dignity. I urge you to pass Senate Bill 498. Thank you for taking the time to listen.
Thank you for the work you do and for being here this evening.
Thank you very much.
Is Kylie Kelsey with us? Okay. Moving to Cecilia Livingston.
Good evening. I apologize. A late evening ER visit interrupted my evening, so I'm glad that you're still here. So good evening, Chairs Lesser and Gilchrist and Ranking Members Case and Perillo. My name is Cecilia Livingston, and I'm the Senior Director of Operations at A&B Home Care Solutions. I'd like to thank you and all the members of the committee for taking the time to hear testimony regarding the critical need for sustainable funding in Connecticut's home care programs. Home care, which is often referred to as personal care services, plays a vital role in the healthcare continuum. It allows individuals who need help with daily activities to live safely and independently at home while preventing avoidable hospital and nursing facility admissions. Our A&B caregivers work with your constituents every day to ensure that they're able to live successfully, independently, helping their families to observe changes that may identify potential health issues before they become acute, and it really improves the quality of their lives and helps to avoid costly facility-based care. Over the past years, I've worked with many of you. I've had the opportunity to speak with several of you and your colleagues about the importance of this particular service in the Husky Health program. And as the state navigates the immense ongoing funding challenges, I wanted to reiterate the message that I have shared in the past. Non-medical personal care services represent a patient-centered, cost-effective approach to help people healthily and be supported at home. It avoids unnecessary use of emergency departments, and it prevents the need for more costly facility-based care settings such as long-term acute care facilities and nursing homes. Public data shows that homemaker services in an individual's home averages less than $6,500 a month, compared to more than $15,000 a month for nursing home care. That equates to a difference of over $100,000 per year per individual. The demand for personal care services has clearly outpaced our ability to meet the need, despite recent rate increases tied to minimum wage adjustments. The reimbursement has not kept pace. As a result, we're losing caregivers to private industry for less grueling work. Other healthcare settings and, as has been mentioned, neighboring states that reimburse at higher rates. One caregiver of ours commuted from New Haven to New York City to work at a higher wage, even covering her own transportation costs. All of Connecticut's neighboring states are reimbursing these services at higher rates, and we're losing caregivers, not just A&B Home Care, but as you have heard, all personal care providers in the state. We urge passage of House Bill 5561, increasing all homemaker companion rates 13% annually for the next 2 years and then 10% annually for the following 3. Without increased reimbursement, we will see continued workforce loss, reduced access to cost-effective home care, and increased institutional care costs for the state. Thank you very much for your time and attention this evening.
Thank you so much for your work you do and for your testimony. Have a great evening.
Thank
you. 121, Ernie Davis.
Good evening, members of the committee. My name is Ernie Davis. I'm the Senior Director of State Government Affairs for Blood Cancer United, formerly Leukemia Lymphoma, and I'm here to provide testimony in support of Senate Bill 3. I've submitted written testimony in lieu of that, and certainly the time of the evening, I'm just going to go over the highlights. First and foremost, wanted to highlight our support for the creation and expansion of access to high quality, affordable healthcare in the bill, obviously through the Connecticut Healthcare Trust and the Connecticut option. We do want to bring attention, though, that these initiatives as laid out in Senate Bill 3 are far superior to some other legislative efforts to expand access to substandard plans, such as association health plans. And certainly the initiatives laid out in Senate Bill 3 are far superior because those other substandard plans take into account pre-existing conditions and would remove enrollees from the very risk pool that this legislation seeks to cover, and would directly undermine SB 3's efforts to provide high-quality insurance and patient subsidies. Another issue of support for us is the financial assistance policies to make healthcare accessible and affordable for patients. Financial assistance or charity care at a hospital is supposed to ease financial burdens, but patients continue to face barriers in receiving the aid that they may be eligible for. As a result, the hospital that should be covering existing financial assistance can end up costing thousands of dollars more in medical bills for our patients. Medical frailty. It's just an issue that we wanted to bring to the committee's attention. We would welcome clarification in the bill that the Commissioner of Social Services, who's tasked within the definition of medical frailty for the purposes of HR 1 implementation, should prioritize a definition that allows self-attestation and also accounts for individuals undergoing cancer treatment and survivorship. And one other issue we wanted to bring to the committee's attention was the transfer of risk portfolios concerns that we had. Our patients tend to be some of the highest risk, and we would urge the legislature explicitly to define what this section means to avoid fracturing or fragmenting overall risk by segregating higher cost, higher risk individuals. If the intent of the language is to provide a mechanism for reinsurance or other risk mitigation approaches that do not fracture the segment risk pool, other than a separate high risk pool, we would encourage that clarification and specification to be made. And again, we would really highlight certainly the financial assistance policies. We, in collaboration with a lot of coalition partners, have done a lot of work on medical debt in Connecticut, and we believe that the financial assistance policies as laid out certainly strengthen abilities of our patients and their families and others to afford their medical coverage moving forward. We support the bill, and I'm certainly happy to answer any questions you may have.
Thank you so much. Thank you for your testimony and for being here in this late hour. We'll take a look at it. Have a great evening.
Appreciate it. Thank you.
Thank you. Letitia Council. Oh, those were in persons. Forget that. I'm so sorry. Jennifer Meister. Mag Morelli.
Thank you, Representative Gilchrist, Senator Lesser, and members of the Human Services Committee. My name is Mag Morelli, and I'm the president of Leading Age Connecticut and Rhode Island. Leading Age is a membership association representing not-for-profit and mission-driven providers serving older adults across the full continuum of aging services and senior housing. I want to thank you for the opportunity to offer testimony on several of the bills before you tonight, and I'll provide just a brief overview of my submitted testimony. First, I'd like to address House Bill 5562 and thank the committee for including sections 5, 6, and 7, which update statutory references to reflect the recent consolidation of Leading Age Connecticut and Leading Age Rhode Island into one organization, now known as Leading Age Connecticut and Rhode Island. So thank you. We also support the provision requiring managed residential communities to post Department of Social Services contact information for reporting abuse, neglect, exploitation, or abandonment. However, we do have concerns regarding Section 9 of this bill. It appears to incorporate 2 federal nursing home regulations into state law, but the language is unclear as to which specific portions are intended. The cited regulations cover a very broad range of requirements, far beyond the antipsychotic medications and informed consent that we believe is what is trying to be targeted. We respectfully ask that the bill be clarified to specify exactly which subsections are intended in order to avoid unintentionally incorporating in the entire federal regulatory frameworks into state statute. Senate Bill 481, which addresses private equity ownership of nursing homes. We understand the strong interest in this issue. We support the concepts of disclosure and transparency contained in the bill, but recommend that the definitions and reporting requirements be carefully structured. In particular, we suggest replacing the term ownership entity with investment entity and aligning any new financial reporting requirements with existing reporting already submitted to the Department of Public Health in order to avoid duplication. In addition, since the intent of the bill is to add additional reporting to DSS, we ask that the requirement be placed on those providers with DSS Medicaid agreements. I also want to note that the federal regulations do already prohibit mandatory arbitration agreements. With respect to Senate Bill 495, which expands the charge of the Long-Term Care Planning Committee, we respectfully request that if new stakeholders are added to the committee's membership, that representation from long-term care providers also be included to ensure balanced discussion and informed recommendations. And we would be pleased to serve in that role. And finally, we support Senate Bill 499 and Sections 9 and 10 of House Bill 5561, which address Medicaid reimbursement for long-term services and supports. Adequate reimbursement is essential to maintaining a strong network of providers, particularly in home and community-based services where workforce shortages are already limiting access to care. Increasing Medicaid rates and ensuring that they are updated on a predictable schedule will help sustain these services and allow older adults to receive care in the settings they prefer, including their own homes. Thank you for the opportunity to testify tonight, and we look forward to continuing to work with the committee on these important issues.
Thank you so much, Mag, for your continued work and for always showing up. Appreciate it. Have a great evening.
You too. Thank you.
Oh, wait,
Hi.
wait.
What?
Unless his hand raised.
Sorry to throw a wrench into it. Just a quick question about the psychotic provision that you were concerned about. If we were to make that change and clarify the specific section of the federal regs that we're referring, you would not oppose that section?
No, we would not oppose it, and we, in our testimony, we point out specifically which sections those are addressed.
Yeah, no, I saw the testimony, but I just want to make sure that thank you for that clarification. Thank you, I appreciate it.
Thank you, Senator. Thank you, Mag.
Thank you.
Next up is Tracy Hunter with us. All right, going to Linda Sprague Martinez.
Good evening, Senator.
We'll bring her back on. There she is.
Sorry, I think I got bumped out just there. Good evening. My name is Linda Sprague Martinez. I direct the UConn Health Disparities Institute, and I'm a professor of medicine at the UConn School of Medicine and the Department of Medicine. Thank you for the opportunity to submit testimony in support of SB 3 and Act Concerning Healthcare Affordability on behalf of the Health Disparities Institute. HDI was established in 2011 as part of a legislative mandate to enhance research and the delivery of care to minoritized and medically underserved populations in the state. HDI was born out of Connecticut's commitment to addressing health disparities and promoting economic mobility. We are in strong support of SB 3 and stand with the Health Justice Now campaign, advocating for quality, affordable health care for everyone in Connecticut. Connecticut residents need real solutions to the healthcare affordability crisis, which SB 3 offers. We specifically support stronger hospital financial assistance programs, a basic health program, a state-run health insurance option, and participatory planning process for these programs to ensure equitable outcomes. Recently, we've been working with the Commission on Racial Equity and Public Health. We have a contract with them to conduct a data-driven participatory planning process to inform their strategic plan. As part of this contract, we've convened a team of community research team that's comprised of residents from across the state of Connecticut who have been involved in designing and implementing a statewide assessment. This allowed us to speak directly with the community residents across Connecticut to identify priorities that they felt would promote health equity. We consistently heard about the cost of healthcare in Connecticut and the fact that it's unaffordable. In fact, making healthcare more affordable and reducing medical debt emerged as one of 4 central goals of the Connecticut Commission on Racial Equity and Public Health Strategic Plan. Through the process, we heard from community members who frequently spoke about the fear of unexpected medical bills, accumulating medical debt, which we've heard all day today, which is compounded oftentimes by confusion over what insurance covers and what it doesn't. Many residents have also shared with us about receiving medical bills for thousands of dollars, but not understanding why and what they're covering. Community members emphasize the high cost of care can lead to fear of being driven into medical debt, and the lack of transparency around what's covered leads to delaying and oftentimes avoiding care. One resident in New Haven told us about, for example, $4,000 bill that she received after already being in medical debt for $8,000. So this isn't hundreds of dollars, it's thousands of dollars. Another resident told us that even when you have insurance, you worry about what the copay is going to be, because it's not just the insurance, but it's what comes after that as well. And imagine if you are worried when they said that imagine if you're worried when you already have insurance. What about people who don't have insurance? The data we've collected across projects, not just the commission project, it's consistently illustrated the high cost of healthcare, and the lack of insurance. Yep, I can sum up. Leave people forced to make impossible choices, to live in worry. And I would like to also emphasize that the worry and anxiety that we've heard about all day, that chronic stress accumulates over time. And so we see healthcare access disparities also contributing to overall health disparities.
Great point. Thank you so much. Thank you for your testimony and for being here this evening.
Thank you.
Kaveh Kashnud. All right, Jennifer Leduc.
Hi, good evening. Chairpersons and members of the Human Services Committee, thank you for the opportunity to testify today. My name is Jennifer Leduc. I am the Executive Director of Day Kimball Health at Home and Hospice, Board Chair of the Connecticut Association for Healthcare at Home, a registered nurse of 26 years, and a proud lifelong resident of the Quiet Corner. I strongly support HB 5561, an act concerning Medicaid rate increases for certain providers. Day Kimball Health at Home provides skilled home health and hospice services to a population across rural northeastern Connecticut that is rapidly aging in place. In our region, poverty, extremely limited transportation options, and difficulty accessing essential services place significant strain on our patients' ability to remain healthy and safe in their homes. In my agency, 3/4 of our patients are over the age of 70. More than half of those are duly eligible for both Medicare and Medicaid. They are some of the most medically complex and vulnerable individuals in our region. Our services are what they depend on to recover at home after hospitalizations and safely manage their chronic conditions. We are deeply committed to serving these patients. In fact, it is truly our mission. But it is increasingly difficult to sustain the level of care they need when Medicaid reimbursement does not come close to covering the costs of providing those services. When that gap is combined with healthcare workforce shortages and access challenges that come with living in a rural community, our options become limited. Families are forced to make very tough decisions. I often find myself thinking about what our patients would do without us. I wish I didn't have to think about that, but it is our reality. I know without us, many of our patients will end up back in the hospital or in nursing facilities, outcomes that are far more costly for both families and the state. That is why I strongly support Medicaid rate adjustments for home health services proposed in HB 5561. These increases are long overdue and will help begin to close the gap between the care being delivered in the home and the reimbursement that providers receive. Home health care is often the only realistic way patients can receive the care they need. I urge the committees to support these rate increases and help ensure that older adults and individuals with disabilities can continue to receive safe care at home. Your support will also help us preserve and grow our dwindling nursing workforce. Home health care is not a convenience or a luxury. It is basic human care. It is a bridge that keeps our residents connected to our healthcare systems, and we cannot afford to watch that bridge crumble. Thank you for your time and consideration.
Thank you so much. My first job was out in the Quiet Corner, so a special place in my heart. Thanks for what you do, and thanks for your testimony tonight.
Thank you.
John Antunes. Oops, sorry about that. Paula Mosho-Gianna. Kevin Bunnell. Amy Martin.
Yes, I'm here.
Great. Go right ahead.
Let me sorry. Okay. Good evening, Senator Lesser, Representative Gilchrist, and distinguished members of the Human Services Committee. My name is Amy Martin, and I am a community mentor and life skills coach. While I'm semi-retired, I work with 2 individuals on the autism spectrum. I am here today to speak in support of Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. My job includes helping my clients find motivation and building the skills they need to live more independently. Things like cleaning their homes, cooking meals, decluttering, and managing their household budgets. I also support their social development, taking them on outings like summer concerts or out to eat. For these individuals, I help make a level of independence possible that may not have been achievable before. I have worked with both of my clients for several years. One of them I first connected with through Key Human Services and later continued with them when they transitioned to GT Independence. However, in late 2024, I was unable to serve that client for several weeks because of delays in transferring paperwork. Even after I was approved to resume working with them in December 2024, GTI told me I would not be paid for weeks. How is that acceptable? Still, I chose to work because my client needed my support. What I did not expect was to go for more than 2 months without a paycheck. That is simply outrageous. I could not pay my bill. I had to ask my stepfather for financial help, and that was humiliating. I was asking my 87-year-old stepfather, who was already caring for my mother and her health issues, to support me. The fact that GTI believed these clients could go without services for that long, or that I could go without pay for the same period, is unbelievable. Taking that long to process paperwork and reconnect a client with a provider they already had simply because of an agency transfer is completely unacceptable. Going months without being able to pay my bills was horrific. It created deep emotional and financial stress that still affects me today. That is something you cannot easily recover from. I know some of our unpaid members have finally been paid, but the damage is already done. It is time for someone to address the ongoing problems with GTI, and if DDS won't do it, we need you, our elected officials, to do so. And the first step is to pass SB 498, because no caregiver should ever go unpaid, not for a day, not for a week, and never for months. Thank you for your time and for listening to my testimony.
Thank you so much, Amy, for your testimony and for being here tonight.
Thank you.
Nilex Gray Husey, Terrence Brown, Betsy Torres, Elizabeth Bausch, Douglas Smith.
Hello, can you hear me?
Yes, we can. Go right ahead.
Thank you very much. Good evening, Senator Lesser, Senator Perillo, Representative Gilchrist, Representative Case, and members of the committee. Thank you for the opportunity to testify today. My name is Dr. Douglas Smith. I'm a board-certified emergency physician practicing in Danbury, Connecticut, and I serve as the president of the Connecticut chapter of the American College of Emergency Physicians. I speak today in support of HB 5561, specifically Section 8. Connecticut is rightly proud of its healthcare institutions and its commitment to caring for vulnerable populations. Yet despite these strengths, access to care remains a growing challenge across our state. One important and correctable reason is that physician Medicaid reimbursement rates have remained effectively stagnant for more than 19 years now, even as the cost of practicing medicine has risen dramatically. Connecticut physicians face a high cost of living, demanding a medical liability environment and reimbursement rates that have not kept pace with inflation. For many physicians, particularly those early in their careers, this makes Connecticut a difficult place to practice and to stay. As a result, we increasingly lose our medical school graduates and trained physicians to neighboring states with more sustainable practice environments. Emergency departments feel this pressure acutely. By law and by mission, we care for every patient, regardless of insurance status or ability to pay. We are the healthcare safety net when access elsewhere breaks down. When Medicaid rates fall too far behind, it does not reduce demand. It simply concentrates it in already stretched emergency departments and hospitals, worsening crowding, wait times, and staffing challenges. This is not about physician income in isolation. It is about whether Medicaid patients can find physicians willing and able to care for them, whether hospitals can staff their emergency departments, and whether communities, urban and rural alike, retain access to timely, high-quality care. Adjusting Medicaid physician reimbursement to reflect inflation and the real cost of care is a necessary step to stabilize our workforce and to protect the access for patients who rely on this program the most. Without action, we risk continued erosion of physician participation, greater reliance on emergency care, and higher long-term system costs. You'll hear additional data today from my colleagues, Drs. Shangold and Moore, further detailing the scope and urgency of this issue. I urge you to support this long overdue Medicaid rate adjustment and to reaffirm Connecticut's commitment, not just to coverage, but to meaningful access to care. Thanks very much for your time and commitment.
Thank you so much. Thank you for your testimony this evening.
Thank you.
Letitia Council.
Oh, well, good evening, Senator, Representative. Thank you guys for coming back to me, even though I was here, but I didn't have it correct. Thank you guys for being here so late. My name is Letitia Council, and I have been a personal care attendant for 2 decades. I am here in front of you today to testify in support of Senate Bill 498 as Act protecting paychecks for personal care attendants and representing and expanding public access to state programs. In all my years of providing care, I have never felt forgotten as I do today. The first time I didn't get paid, I was broke down. I started crying. I panicked because I figured, how am I going to pay my bills? How am I going to feed myself? I don't get food stamps. I have to borrow money. The last thing I wanted to do was borrow money from someone. That's the worst thing to do, especially when you don't get paid, because how you going to pay it back? My options were quickly limited because it didn't happen just once. It happened multiple times, and it affected many of us. We already live paycheck to paycheck. Our hours are limited to what Medicaid approves, which sometimes mean losing expected hours with little notice. On top of that, not getting paid is devastating. You're left constantly wondering what will happen next. And yet every single day I still show up for work. One of my clients is blind. The other one is bedbound. I take my job very serious. I love my job. I've been doing it for a very long time. I just we have filed thousands of grievances. We had to show up at their headquarters twice, and still hundreds of members have not been paid. It's not an old issue. It's still going on today as we speak. PCAs are still not being paid, and the issue is a back and forth between DSS and GT because nobody knows where the problem lies at. It is time for the state of Connecticut to start validating healthcare workers. Every single one of us, PCAs, are a critical part of healthcare systems in the state, yet we are frequently overlooked. We are treated as if we do not matter. The constant feeling of being undervalued is deeply painful. So today, I don't just urge you, I strongly call on you to pass the bill 498 because it will start to address the ongoing payroll failures affecting thousands of people across the state. And I just want to point out, my client, once again, is blind. So in order for me to go into his portal is a violation of HIPAA, but he can't see to do it himself. So I don't have no other choice sometimes to go in there and check his information. But is that can I get in trouble for that? Like, I just don't understand. Like, nobody comes here and check on him. Nobody calls and comes by. So how is that? How is the state allowing that to happen?
Thank you so much.
And
Thank you.
thank you. And thank you guys for your time.
Yeah, truly appreciate it. Have a good evening.
You too.
Tanisha Joyner, Phoenix Lightbringer, Rosa Rodriguez, Farita G, Thomas Burr, Kenneth Colmeyer, Jacqueline McGrath Curtis, Cynthia Johnson.
I'm here.
All right, go right ahead.
Good evening, Senator Lester, Representative Gilchrist, and distinguished members of the Human Services Committee. My name is Cynthia Johnson, and I'm a personal care attendant for my daughter. So I sit here before you today, not just as a healthcare worker, but also as a parent who is constantly worried about caring for and providing for her daughter. Passing Senate Bill 498, an act protecting paid checks for personal care attendants and expanding public access to state programs is not just a necessity. It's the importance of survival for all of us. My daughter, she started having grand mal seizures at the age of 6. Since then, she has been having different types of major seizures. It's gotten complicated because she also now has vertigo and suffered PTSD from drop seizures, the traumatic falls that accompany them. As you know, that is very scary and is very serious. As a mom, it breaks my heart every time I see her having these seizures because I can't stop her suffering. However, my daughter is determined to go on and become a productive American. She wants to go to college and become a veterinarian. I want to make sure that she does not do it alone and she makes that goal. Unfortunately, we now have additional added stress in our household because of the non-payments that me and others have suffered through GTI and Ally. Luckily for me, it hasn't occurred as many times as others, but it is something that we are worrying about again, worrying about whether or not we get paid or worrying about whether we're going to get the right amount, whether it's this, that, and the other. And it's just not fair. It should not be happening. When did this become acceptable? In the past, we experienced pay loss. I've experienced it. Others have experienced it. And it's just not acceptable. We should be getting paid on time, every time. This issue causes severe financial stress for the family, for all our families. We already working paycheck to paycheck. Please do the right thing. Make sure and pass the bill, SB 498, not just for me, not for some of the others that you heard, but thousands of the PCAs that are giving love, giving care to others that are unable to care for themselves. Thank you for your time and thank you for hearing my testimony. If you have any questions, feel free to ask.
Thank you, Cynthia. Thank you so much for your testimony and for being here tonight.
You're welcome. And thank you.
Is Dale Elliott with us? All right. Bridget Prince came earlier. Tamara came earlier. Jean Paul Gamez. Miriam Hakeem Zargar. Doctor.
Good evening, or good morning, I should say, Representative Gilchrist, Senator Lesser, distinguished members of the Human Services Committee. Thank you again for this opportunity to testify. And thank you for being here and listening to all this testimony. For me personally, it's been very educational listening to everyone else's testimonies. But my name is Mariam Hakim Zargar. I'm a orthopedic surgeon and president of the Connecticut State Medical Society. I'm in a solo practice in Torrington, Connecticut. I'm here in support of increasing Medicaid physician payment rates and to comment on bills 499 and 5561. In my practice, about 20 to 25% of my patients, particularly after I take call for the emergency room, have Medicaid. Even running a very lean office, each Medicaid visit reimburses roughly half of my overhead costs. I'm in a unique position as I didn't incur much debt as for my medical education, but most of my colleagues simply can't afford to see Medicaid patients at these rates. Medicaid patients have real access and outcome issues. Here's a story for you. Father in his 30s working as a manual laborer, injures his foot while playing with his kids. And then he goes to urgent care. They take some x-rays. They say he has a metatarsal fracture. That's a type of foot fracture. And they place him in a boot and tell him to follow up with orthopedics. He calls multiple offices, can't get an appointment because they don't accept his insurance or the next available appointment's too far out. He can't work and he's losing income. Eventually he goes to the emergency room because really that's his only option to get access to care. By the time he's seen by a specialist, what was initially treated as a simple fracture is now recognized as a more complex midfoot sprain injury that now has displaced and needs surgery. And this is going to put him now months out of work. And this could have been avoided by timely care into something that would have healed in 2 to 4 weeks to now something that's going to take this man out of work for 3 to 4 months. And that affects the entire livelihood of this family. So this isn't an isolated story. In my office, I have these kinds of injuries at least once a month, and I'm just one doctor. And across the state, you can imagine how many people and how many lives are affected by this. Low Medicaid rates are a workforce issue. Connecticut struggles to retain physicians, and young doctors choose to practice in states where reimbursement support and sustainable practice. Low Medicaid rates are also a health equity issue and a cost issue. When patients cannot access care, conditions worsen, leading to more expensive emergency visits, hospitalizations, and long-term complications. We are also concerned that proposed increases may apply to some physicians, but not others. A piecemeal approach is how we got here. In Connecticut, if Connecticut wants better access, better outcomes, and a stable healthcare system, it must invest in Medicaid physician rates across all specialties. Thank you again for the opportunity to testify, and I'm happy to answer any questions.
Thank you so much. Thank you for the work you do and for your testimony.
My pleasure. Thank you.
Have a good evening.
You too.
Sherilyn Healy. Nashley Rose.
Good morning. How are you guys?
Good morning.
Good morning. All right. So, good morning again, Senator Lesser, Representative Gilchrist, and members of the Human Services Committee. My name is Nashley Rose, and I live in Manchester, Connecticut. I am testifying in support of SB 497 and SB 3. SNAP is about keeping people fed with respect and dignity. Right now, federal cuts are putting thousands of Connecticut residents at risk of going hungry, including babies, children, senior veterans, and people with disabilities, and thousands more at risk of losing their Husky health coverage. There are many reasons why people need Husky and SNAP. Here are my top 3 reasons why we need Husky and SNAP. Reason number 1, cuts to Husky and SNAP limits access to healthy foods for low-income families. Without Husky and SNAP for families, especially low and working-class families, it will negatively affect individuals, creating such difficulties for families to be productive members of society. Reason number 2, loss of free school meals worsens students in schools. Loss of free school meals affects an individual of food insecurities at home. The individual may function poorly in school. The less food, I call it, the less education. Lastly, reason number 3, increased hospital visits can't happen due to loss of coverage of Husky. Without Husky, Hospital visits will soon become a higher burden than it already is. This is a problem for all families that prevent them from ensuring a safe life. States funded SNAP transitional benefits give people a bridge of support, so no one loses food while they are getting their SNAP eligibility approved. This is the state doing its job, protecting residents from having to choose between seeing a doctor or putting food on the table. I support these bills because Connecticut should put money behind protecting our access to food and healthcare, so no one falls through the cracks. The number tells the story. Right now, the state is not sharing how many people lose Husky and SNAP due to federal cuts. Our communities deserve to know how many of our people and families are losing their food and healthcare, and this bill makes that information public. People who qualify for Husky and SNAP should not lose healthcare and food because of paperwork. This bill directs the state to automatically identify who qualifies for an exemption from work requirements and protects them. Lastly, SNAP and Husky are about respecting our families and protecting our health. I'm asking this committee to pass SB 497 and SB 3. Nobody should have to choose between feeding their kids and keeping them healthy. Please keep us protected from federal benefit cuts with state investments that bridge the gap. Lastly, for me, I am the second oldest out of 8 siblings, and I have 2 hardworking parents that work their behinds off to put food on the table. Most of my other siblings are in high school currently. I used to do track and field and basketball, and they would have to go to the nurses to make sure that they have insurance and Husky. But the absence of Husky, that's going to affect my younger siblings as well. I contribute most of my time working to provide for my family as the second oldest out of 8. And just even with the absence of SNAP, that also affects us as well as with working class families as we're trying to be productive members of society. So passing this will not mean so much for me, but for thousands of Americans that are also struggling as well. Any questions or concerns?
Thank you so much. Thank you for your testimony.
Of course.
Have a great.
Thank you. God bless you guys. Have a good one. Bye-bye.
Next, Gretchen Raffa.
Good morning, Representative Gilchrist, Senator Lesser, and honorable members of the Human Services Committee. My name is Gretchen Raffa, Chief Policy and Advocacy Officer at Planned Parenthood of Southern New England, testifying in support of raised House Bill 5561, an act concerning Medicaid rate increases for certain providers. As one of the largest providers of sexual and reproductive health care to over 52,000 patients at 14 health centers across the state and telehealth last year, we believe all people should have access to quality, affordable health care as a basic human right, regardless of who you are, where you live, your income, if you have health insurance, or your immigration status. We're very grateful to Governor Lamont, this committee, and the General Assembly for your commitment and strategic investments in women's health care and family planning, including supporting a one-time allocation to backfill blocked federal Medicaid funding due to the harmful actions by the Trump administration and Congress in H.R. 1. Yet greater state investments in our public health infrastructure are urgently needed to ensure reproductive health care providers like Planned Parenthood of Southern New England can continue providing essential care to the people who need us most. HB 5561 is a necessary step the state must take this session, and why we're here before you tonight, just as we were last year, asking for an increase in Medicaid reimbursement rates for family planning providers on the family planning fee schedule. Planned Parenthood health centers have an irreplaceable role in our healthcare system in Connecticut, and for many communities, we're the sole provider of sexual and reproductive health care. In the last fiscal year, 46% of PPS&E patients were insured by Husky Health to cover their services, and 24% were self-pay. 87% of the care delivered is preventive or gynecological care. PPS&E is a safety net provider that reduces burden to the healthcare system, but without the buffers that other safety net providers have. Unlike private practices, PPS&E has little ability to offset low Medicaid reimbursement rates with higher private insurance rates because of our service mix, and without high margin services to offset losses. We're facing serious operational pressures, including not being adequately compensated for care provided while the cost of delivering that care continues to rise, threatening our ability to continue meeting the needs of patients and communities. 1 in 3 women have been to a Planned Parenthood health center for care. No other provider can easily fill the gap if Planned Parenthood is forced to shut down. That's according to research done by the Guttmacher Institute. In 9 states, including Connecticut, FQHCs and other publicly supported clinics would need to increase their caseloads by more than 100% to provide care for patients currently served by Planned Parenthood of Southern New England. We urge the legislature and Governor Lamont to prioritize increases to Medicaid reimbursement rates for family planning clinics now to ensure continued care for our patients and communities in the future. Based on patient volumes across the state for previous years, we estimate a rate increase for preventive services at family planning clinics would require a state investment of approximately $500,000. An investment of this amount is based on Maine's family planning rates, which is a benchmark state from the Medicaid rate study. Access to reproductive health care remains vulnerable here in Connecticut. We're concerned about the continued inequity in access to healthcare for residents of our state and barriers they face to healthcare coverage, which has only worsened due to HR 1 and other federal actions or inactions. We look forward to continuing to work with our elected leaders to find long-term solutions to this very real financial challenge that continues to threaten access to essential reproductive healthcare in our region. And we need greater investment in family planning providers and clinics now. Planned Parenthood patients are counting on you. Thank you for your time and consideration, and we'll also be submitting testimony in support of SB3 as well.
Great. Thank you so much, Gretchen. Thank you for all your advocacy and for being here.
Thank you.
Joseph Avni Singer, Kathleen Garrity, Gregory Shangold, Heather Gates, Joseph Downer, Nancy Jones, Lindsay Russo, Henry John, Susan Beck, Quinn Meehan, James Lehman, Pearl Barnett.
She already went.
Okay, thank you. Melinda.
I'm getting notified that there are folks who are trying to get promoted and are in the queue, but they haven't been promoted.
Okay, they're not. And if people do hear their name, then they should, right? Like, that's kind of the point.
They should accept the promotion.
Yeah, if you hear your name, accept the promotion. Fiona Crowley.
Hello, good evening, Senator Lesser, Representative Gilchrist, and esteemed members of the Human Services Committee. My name is Fiona Crowley. I'm a resident of Taunton, Connecticut, and tonight I'm speaking as a student in the University of Connecticut's Master of Social Work program. I stand in support of SB 496, an act concerning hospital uncompensated care, and Section 10 of SB 3, an act concerning healthcare affordability. In my education, I've had the honor and privilege of working with organizations led by folks that know firsthand the impact of not being able to access their basic human right to affordable care. When families face unaffordable care costs, they are at risk of acquiring medical debt, making sacrifices to basic needs, and avoiding preventative and life-saving care. Community members have shared stories of stress over costs worsening their health when they're sick. When they do seek care, high out-of-pocket costs cause financial setbacks. When they are made aware of financial assistance options, the application process can be lengthy and complex. Folks without insurance often describe affordable care as a far-off dream, and this is a population we know will increase by over 200,000 in Connecticut by 2034 because of cuts and policy changes under HR 1 that will disproportionately burden Latina, AOX, and non-Hispanic Black residents. Today, I am urging Connecticut's leaders to turn the right to preventative and life-saving care that does not hinder overall well-being into a reality. Community members are exhausted. Year after year, they voice the barriers they face to affordable care, and year after year, they are burdened by the emotional and financial stress of simply trying to stay healthy. When all of Connecticut's communities cannot be healthy, Connecticut cannot be healthy. Nonprofit Connecticut hospital spending in the 2024 fiscal year remained less than revenue. While spending grew by 6% from 2023 to 2024, charity care accounted for about only 3% of total expenses. A large portion of hospital costs went to salaries and wages. Unfortunately, national disparities in salary increases for nonprofit hospital CEOs and healthcare workers indicate a pattern of hospital systems not equally investing in their community members who provide preventative and life-saving care. SB 496 takes a critical step towards affordable, accessible care for all by standardizing hospital systems' financial assistance policies. According to the Connecticut Hospital Association, hospital financial assistance requirements can change from year to year, making a complex process more complex, with changes that require administrative costs. Community members should not have to choose between seeking potentially life-saving care at a hospital closer to them and finding one where they are eligible for financial assistance. Thank you for the opportunity to testify in support of SB 496 and SB 3, and I urge the committee to favorably pass this bill. In my written testimony, I've included recommendations on presumptive eligibility for SNAP and WIC recipients and the incorporation of race, ethnicity, and language data into reporting on hospital financial assistance to the Office of Health Strategy. Thank you for your time.
Thank you so much. Thank you for your time and for your testimony this evening. All right. Have a good night's sleep. Kevin Alexander. Marlene Ciccarella. Okay. Lynn Offori. Oh, sorry, messed that up.
Hi, I'm 177, but I'm Diana Martinez, not Lynn.
Got it. Thank you. Go right ahead.
Thank you. Good morning, Human Service Committee members. Thank you for the opportunity to speak. I'm Diana Martinez. I'm the founder and executive director of Chickasaw Farm. Our organization works at the intersection of food justice and the criminal justice system with the dual goals of increasing access to farming for underrepresented and directly impacted people and organizing to address the gaps in our social safety net that land people in the criminal justice system in the first place. Our members and leaders support people in all matters of small-scale farming. We often encourage people with SNAP benefits to purchase organic produce at farmers markets and harvest their seeds to start their own seedlings. Over the course of the past year, we learned that some of our community members are denied or thought they were unable to access SNAP benefits even if they earn well under the income limits, simply because they have a violation of probation or parole. Today, over 3 times as many people as are in prison are under supervision. Many thousands of others in our communities have completed supervision at least once, and over half of people on probation earn under $20K a year, which is a reality exacerbated by race and gender, as evidenced by 70% of all women and 81% of Black women on probation earning under $20K. Violations of supervision are also very commonplace and can be triggered by new crimes or by technical non-criminal violations like missing a probation appointment or failing a drug test. At least 20% of formerly incarcerated people report experiencing food insecurity, and in Connecticut, where the vast majority of people incarcerated come from our major urban hubs, that insecurity is bolstered by food deserts and the lack of farms in urban and suburban spaces. Members of our organization launched the Free CT campaign to address the failures of our supervision system in enabling successful reentry and to ban the box on food access. We queried the prison policy initiative and learned Connecticut goes well beyond the federal mandate in restricting SNAP benefits. Federal regulations deny SNAP access to people with underlying felony drug charges who are probation violators, which is a term they use to specifically refer to people with active warrants for their arrest, as opposed to any person with any violation of supervision. In addition to the state law, the SNAP application further deters people from applying for benefits by very broadly asking, do you or any member of your household have a violation of probation or parole? Today, we're urging you to vote yes in support of SB 497 and Act concerning protecting food security for veterans and others, because it would both align our policies with the federal government and eliminate or amend the violation question on SNAP applications. Community supervision is meant to help people establish themselves, reestablish themselves, and re-engage with their families and contribute successfully to our communities. Restricting access to food runs directly counter to those goals because we know people are far less likely to recidivate if their basic needs are met, and food is as basic as it gets. Please help us keep people home and keep people fed by voting in support of SB 497. Thank you.
Thank you so much. Senator Lesser, go right ahead.
Yes, thank you, Madam Chair, and good to see you, Diana. I believe I saw you 14 hours ago at a
Yeah.
very long day.
Long day. Thank you.
Just wanted to thank you for raising this issue. I do note that the department, which had a lot of concerns with that bill, actually seemed to understand and support. I don't support maybe a little bit much, but they seem to be very much open to the suggestion that you're making. And I thought that was a very positive statement in their testimony. So I just I'm grateful for you to advancing the issue, and I hope we can move that forward.
Thank you. Thank you for your support.
Thank you so much. Thanks for your testimony and your work on this, and have a great evening.
Good night. Bye.
Next, we'll go back to number 160, Kathleen Garrity, followed by 161, Gregory Shangold.
Thank you very much, Representative Gilchrist, Senator Lesser, and the rest of the committee members, and thank you for hanging in there for a very long day. I've been here the whole day, and I feel like I could just say ditto to a lot of my other colleagues, but I will persevere. My name is Kathleen Garrity. I'm the Executive Director of the Connecticut State Dental Association, representing licensed dentists and the patients that we serve across the state. We have provided written statements on SB 3, SB 499, HB 5041, and HB 5561 with recommendations on all those bills, including specific language recommendation for the last bill, 5561. We started today on St. Patrick's Day, but it kind of feels like Groundhog Day because we find ourselves before you once again discussing a decaying provider network, reimbursement levels that do not reflect the cost of care, and the growing consequences for patient access. But it's important to remember we have seen this before, and we have also seen what works here in Connecticut. In 2007, Connecticut was considered the gold standard in Medicaid dental care. We had a stable and robust network of providers, and the reimbursement rates, while not perfect, were sufficient to support participation. Patients not only had access to care, but convenience of care. This led to what has become known as the Connecticut effect. Studies demonstrated that when the dental network was stable and functioning, Medicaid patients experienced measurable improvements not just to oral health, but overall health. Improved dental access was associated with better management of chronic diseases, fewer complications, healthier populations, and less ED appointments. That is the standard we should strive towards again. Today, however, we are moving the opposite direction. We are already spending the money that should have been invested in the system all along, just in the most expensive and least effective ways possible. Redirecting it into preventative and timely dental care doesn't create a new cost. It replaces avoidable medical spending, ED visits, chronic diseases, hospitalizations. We can replace all those with appropriate care. I also want to represent many of our young dentists who are moving into Connecticut. Most entered this profession with a genuine commitment to public health, many of whom have their MPHs. They simply cannot afford to participate in the Medicaid program. They find that the economics of the system make participation unsustainable. And we have many experienced providers who have carried this program for years that are either reducing their participation, leaving altogether, or retiring. This is not a question of willingness, it's a question of viability. That's why SB 499 is so important. It is critical that dental services are explicitly included in the rate setting process and that benchmarks are based on objective real-world data. I'm just going to skip over this and go right to the fact that there already is data that we've pointed out several times to you before called Fair Health Database, which compiles actual claim data and establishes the UCRs that are already in place by procedure and geographic region. This is what we need in the dental world because Medicare rates do not always translate to Medicaid for dental. They just simply don't exist. So please look at the Fairhaven Data Bank. Similarly, you consider broad healthcare affordability efforts under SB 3 and coverage expansion under 5041. Oral health must be included explicitly in these. They're not right now. It says healthcare, but very often we find that dental care does not get included when it comes down to the fine tuning of these bills. And with respect to 5561, we encourage careful attention to clinical language. The term periodontal therapy for healthy adults does not address the intent. Our written statement, I can go into that more, but basically periodontal therapy is when there's already disease in the mouth. So a healthy adult, by definition in this bill, cannot have periodontal therapy. In conclusion, the lesson from 2007 is clear. Maintaining a strong provider network requires consistent investment that reflects the real costs of care. Standing back and allowing that network to erode leads us exactly to where we are today. History cannot repeat itself. We respectfully request the SDA be included as a stakeholder in all discussions regarding the Medicaid policy and next steps for the programs within OPM, DSS, and other spaces. Our involvement will ensure that the policy decisions translate into meaningful access to care for our patients. Thank you for your time, your consideration, and for sitting through yet another Human Service Marathon hearing. You guys are the champions.
Thank you so much. Thank you for being here and thank you for your testimony. Gregory Schengold, go right ahead.
Decisions translate into
Good evening, Representative Gilchrist, Senator Lesser, and remaining members of the committee. Congratulations for staying awake. Feels like one of my night shifts. My name is Gregory Schengold. I'm a board certified emergency physician and practice in Connecticut for 24 years. I'm the past president of both the Connecticut State Medical Society and the Connecticut College of Emergency Physicians. I currently lead a group of 90 emergency physicians and advanced practice providers staffing 7 of Connecticut's emergency departments that collectively care for approximately 600 patients a day. This is the 4th year consecutively we've debated Medicaid reimbursement rates that were last set in 2007. Over those 19 years, healthcare costs have risen dramatically while physician reimbursement has remained frozen. At this point, there is broad consensus that the current rates are unsustainable. In my written testimony, you can evaluate the evidence and detail providing that need. Connecticut now ranks 46th in the nation for Medicaid reimbursement for most physician services. At the same time, the Medicaid population has grown to more than 1 million residents, including nearly 30% of Connecticut's children. When reimbursement is this low, physicians limit their participation in Medicaid and access to care declines. In the emergency department, we see the consequences every day. A recent example is a patient with poorly controlled diabetes who repeatedly comes to the emergency department with dangerously high blood sugar and complications. She has Medicaid but cannot find an endocrinologist willing to take new Medicaid patients. Without consistent specialty care, condition worsens until she ends up back in the emergency department. This is not good care for the patient, and it is far more expensive for the healthcare system. Physicians appreciate that HB 5561 recognizes the unique role of emergency medicine, but the broader issue remains that most physicians' Medicaid rates have not increased in nearly 2 decades. SB 499 moves in the right direction by benchmarking rates to the Medicare Economic Index. However, the proposed increase to 75% of Medicare by 2029 is not sufficient to address 19 years of underpayment. To make a meaningful difference in the access to care, physician Medicaid reimbursement should be increased immediately to Medicare rates and then adjusted annually using the Medicare Economic Index. Connecticut's emergency departments are already stretched thin, and emergency physician burnout now affects nearly 70% of the workforce. The deboarding task force created by this legislature recognized this problem and recommended increasing Medicaid reimbursement as part of the solution. This is the 4th year we have discussed this issue. The need is clear. The data are clear. What is needed now is action. Strengthening Medicaid reimbursement strengthens the entire healthcare system and improves access to care for all of Connecticut's residents. Thank you for your time and consideration.
Thank you so much. Representative Johnson?
I just want to thank Dr. Schengold for staying up and testifying and all of his work that he's done here in Windham and throughout the state. So thank you so much.
Thank you, Representative.
Thank you so much. Have a great evening.
Have a good night.
178, Michael Lung.
Good morning. I'm Michael Long out of Southbury, and I'm the Vice President of Operations for both Companions and Homemakers out of Farmington and Companions Forever out of Newington. I have been an employee of Companions and Homemakers for over 15 years. I'm speaking in support of HB 5561 concerning Medicaid rate increases for certain providers. My two companies currently provide non-medical home care for a total of 840 older adults throughout all of Connecticut. The care provided to 99% of these individuals is paid for by Medicaid waiver programs. Our business focuses on those who are most in need of assistance with daily living and who depend on these programs. While many of our competitors have been forced to limit assisting federal and state-funded programs due to inadequate reimbursement rates, we have taken the opposite approach up until this point. The truth is that we are now forced to consider cutting back on Medicaid-funded services due to increased operating costs and the ever-increasing difficulties in recruiting quality caregivers. Connecticut's inadequate reimbursement rates have affected us all. Our clients deserve to be cared for by qualified caregivers, but many of those caregivers seek employment in neighboring states. The caregivers that choose to work in Connecticut are paid minimum wage or slightly more and struggle to support their families. Our approach to client care has had to shift from finding the perfect match to finding an able body. Most recently, I've been forced to make difficult business decisions and reduce my office staff, something all businesses strive to avoid. We have asked for several years to be heard. We have asked for a systematic approach to adjusting Medicaid reimbursement rates. Too many years of inaction have led us to this point, but HB 5561 can fix that. Our elderly population have put in their time, and now it is up to us to ensure they receive the care they need and deserve. It is time for the state's Medicaid rates to accurately reflect the importance of this service and match the quality of care we are expected to provide. Thank you for your time and support.
Thank you so much. Thank you for staying up with us and testifying tonight.
My pleasure.
Have a great evening. Or morning. I'll stop saying whatever. 179, Michael Biondi. Dr. Biondi. All right. Sandra Ferreira Molina.
Hi, everyone. Thank you for allowing me to testify. I represent the Connecticut Oral Health Initiative, and I'm here to testify in strong support of Raise Bill 5561. As I've sat here through these hours, I would like to point out something that often goes unnoticed in these halls or in these Zoom meetings is that every person who has testified tonight has had the teeth and the oral health necessary to be able to testify. For many of the Husky members we serve, chronic dental pain or tooth loss is a literal barrier for having a voice in this process. Right now, a Husky dental system is reactive. We wait for a crisis instead of preventing one. We are essentially asking our neighbors to get sick enough to qualify for the care that would have kept them healthy in the first place. HB 5561 changes that. I would like to draw your attention to line 23 through 24. Currently, Husky adults live under a $1,000 annual cap. If they get a routine cleaning, the cost is deducted from their cap. If they then have a dental emergency, they are often forced to choose between fixing a broken tooth or staying within their budget. By exempting preventive and medically necessary services like dentures from the cap, you are ensuring that baseline health is no longer a financial penalty. Look at line 47. This is also a game changer for health equity. COHI is in agreement with CSDA, as Kathleen mentioned earlier, in correcting the language. It should be periodontal treatment to reflect deep cleanings for all adults. Right now, our system is a wait and see. We often deny deep cleanings until a patient is already diagnosed with a comorbidity like diabetes or heart disease. But gum disease is not just about teeth. It is about a systemic inflammatory crisis. In Connecticut, nearly 47% of adults over 30 have some form of gum disease, and that number jumps to over 60% for Hispanic and Black adults. Treating this early reduces a cardiovascular events and can lower medical costs for diabetic patients. However, We cannot talk about these services without talking about the people who provide them. It is critical for dental providers to be fairly reimbursed in order for them to actually support these patients. Without sustainable rates, these benefits are just words on paper because no one will be able to afford to provide the care. Finally, I would like to suggest a technical correction in instead of the Connecticut Dental Health Partnership, which is a contractor vendor to the Department of Social Services, the seats that are being added to be part of MAPOC to be asked from the Dental Policy Advisory Coalition, DPAC. This would avoid conflict of interest to ensure that there's independent advocacy-driven voices at the MAPOC table. And last, I just urge you to pass HB 556 and move Connecticut towards a prevention first system. Thank you for listening and hope everybody has a good night.
Thank you so much. We will
Thank you.
take a look at your testimony. Have a nice night. Next is Daniel Fress.
I believe I'm speaking on behalf of him. My name is, can you hear me? Sorry. Chris Moore. So Senator Lesser, Representative Gilchrist, Representative Comey, Representative Hughes, Representative Johnson, Representative Santiago, and anyone else who's still listening. Thank you for the opportunity to present my testimony in support of SB 499 and HB 5561, which address the need for increased Medicaid reimbursement. Like Dr. Shanghold, I'm happy to see you guys here so late. It feels like a night shift. I'm a board certified emergency physician, and I practiced at an urban level 1 trauma center emergency department in Connecticut for the last 25 years. I currently serve on the board of the Connecticut College of Emergency Physicians. I also served as the prior co-chair of the Emergency Department Boarding and Crowding Task Force, and recently on the Discharge Challenges Working Group, which tries to address many issues regarding capacity for care in Connecticut. We recently submitted our report this week, and many of our recommendations are directly relevant to these bills. I first started working in the ED in Connecticut in early 2002. In my time here, I recall one overnight shift where we actually had taken care of all the patients. They'd either been admitted or discharged. The grease board, as they called it in those days, where we actually physically wrote patient names, was clear. We had, quote, won the game, unquote. Of course, that only lasted a few minutes until the next patient checked in. Fast forward to 2026, winning the game is now impossible. At the main emergency department where I work, we routinely care for more than 300 patients a day. We sometimes have as many as 100 patients boarding in the emergency department. These are patients who have been admitted but remain in the department, often in hallways and on uncomfortable stretchers awaiting an inpatient bed. Data from hospitals in 2024 showed that more than 38% of admitted patients boarded for more than 4 hours in Connecticut, and 2025 data showed little change. The changes we see in EDs have happened slowly. Like the proverbial frog being boiled, we get used to it, but make no mistake, our healthcare system is straining. EDs in Connecticut are the place where a healthcare system under stress becomes apparent. This is not just an issue for patients on Medicaid, it affects anyone who may have an emergency. The last broad-based major adjustment to Medicaid payments to physicians was in 2007. Underfunding Medicaid has broad effects on the healthcare system. In particular, it makes it harder for patients to get care early when they need it as an outpatient. The ability of patients on Medicaid to see a primary care physician or specialist becomes more limited when reimbursement is low. Where do these patients go when they can't get care? You guessed it, the emergency department. The only place in America that is legally required to provide care regardless of ability to pay or how much the state decides to reimburse. EMTALA, the Emergency Treatment and Labor Act, was enacted in 1987 to assure that no one requiring emergency care could be refused treatment. I am proud to work in an environment where that is the case. However, it is an unfunded or at least underfunded mandate. Our ability to care for people without appropriate reimbursement is not unlimited. We have debated Medicaid payment adjustments for years. It is time to stop kicking the can down the road. Please do the right thing and fund this the way it needs to be funded to help ensure all Connecticut residents get the medical care they need when they need it. And thank you again.
Thank you so much. Appreciate you being here and for your continued advocacy. Just want to remind folks that they need to accept the promotion. Next up is Kevin Johnson.
Good morning, members of the Human Services Committee. My name is Kevin Johnson, and I'm honored to speak on behalf of Gaylord Specialty Healthcare in support of Section 11 of House Bill 5561, which provides Medicaid rate increases for certain providers. The biennium budget includes $45 million in fiscal year 2027 to help providers cover the cost of care and treat more Medicaid patients. Gaylord is one of only 2 long-term acute care hospitals, or LTACs, in Connecticut. We provide highly specialized hospital-level care to patients recovering from catastrophic illness or injury. Our patients are medically complex, clinically fragile, and often cannot safely transition to a lower level of care. They typically need weeks of intensive medical management, interdisciplinary rehab, and specialized services just to stabilize and regain function. While we provide the same level of complex care as our peer LTAC in Connecticut, Medicaid reimbursement does not reflect that. Today, Gaylord is reimbursed roughly $950 per Medicaid patient per day, which is only about 58% of our average Medicare rate, and far less than what comparable providers receive. This gap has grown over the past 20 years, even as staffing, technology, pharmaceuticals, and regulatory costs have increased dramatically. Gaylord absorbs that difference every day to make sure that our patients get the care that they need. This inequity also affects Connecticut's healthcare system more broadly. When Medicaid rates don't match the care provided, it strains specialized post-acute providers and limits access for patients who could really benefit from Gaylord services. Fair, equitable reimbursement would help support appropriate patient placement, improve hospital throughput, and reduce costly prolonged stays in acute care hospitals. The proposed increase in Section 11, $206 per patient per day, would finally bring parity for LTACs in Connecticut. This is an important step towards making sure reimbursement reflects the complexity and cost of care we deliver and preserving access for the state's most medically complex and vulnerable patients. Thank you for your time, your consideration, and your commitment to strengthening Connecticut's healthcare system.
Thank you, Kevin. Good to see you again. Thank you for your testimony tonight, and have a great rest of your evening.
Thank you.
184, Miles Bradley. 185, Jacqueline Bias.
Good night, everyone. Thank you for the opportunity. My name is Jacqueline Bias. I am a domestic worker and also a community organizer with Nagatu Valley Project in Waterbury. I am part of Bowman Wisdom Circle and Sheet Leaded Justice. I am here to testify in support of the Senate Bill 3 to protect and strengthen access to health insurance, especially for our children and the families who need it most. Today I stand before like you and a grandmother. I have an 8-year-old grandson named Javier. He used Husky Health. He is currently facing health issues and requiring him visit various specialists. However, in our city, we often lack access to this medical service. Due to the shortage of specialists in our local hospital, we frequently need to travel to other cities so that can be receive the care he needs. We had to travel as far as Wallingford and even to the Children's Hospital in Hartford. For many families, this might seem like just a simple trip, but for us and for many other working families, every medical appointment means organizing transportation, time, and resources that we simply does not have. Javier's mother, my daughter, she does not have a car. Thank God my other daughter and I, we have a car, so we can take him to the medical appointment. But I constantly think about the families who do not have the kind to support. What happens with the parents who don't own a car? What happens to the mother who have to choose between go to work or take their child to the doctors? What more health insurance cover often places limits or essential service, such as transportation. This create another barrier for families who are already struggling. Let's reflect on something very important. The kids who need medical care today represent our future in our country. When the child does not have received a care they need, it's not just one family that suffers. Our entire community suffers. That is why I want to say something with absolute clarity. Access to health insurance is not a luxury, not a gift. It's a human right. Every human being deserves the opportunity to live a life of health and dignity. Today, I ask to you and the legislators to listen to the stories of working families. I ask to you to recognize that this is not just matter to the public policies, it's a daily reality for thousands of families across the Connecticut. We ask you to support legislation that protect and strengthens access to health insurance, especially for our children and for the families who need it most. Because when you protect the health of our children, we are protecting the future of Connecticut. Thank you and God bless you.
Thank you so much. Beautiful testimony. Thanks for
Thank
being
you. Thank you. Good night.
tonight. Paul Kidwell, Christina Diaz, Chris Butler, Jennifer Wheeler, Lisa Allen, Sandy Pope, Zondali Rodriguez, Shakira Rivas, Natalie Shirtliff, Ashley McCarr, Nicholas Glom, Susan Halpin.
Good morning, everyone. It's a pleasure to be before the Human Services Committee. Thank you all for sticking with us for the duration of this hearing. For the record, my name is Susan Halpin, and I'm here tonight, or this morning, on behalf of the Connecticut Association of Health Plans, which is inclusive of Aetna, Anthem, Cigna, Connecticut, and United. And I'm testifying on two bills of note on your agenda, both Senate Bill 3 and HB 5041. We share the legislature's and the administration's goal of improving access to and affordability of coverage of care. Senate Bill 3, respectfully, we have to oppose as it's currently written because we read it to fundamentally restructure the coverage marketplace in Connecticut by creating what we view as a pathway to a public option, a change from the Covered Connecticut program to a basic health plan. And also there are some pretty significant prior authorization timelines that are changed that we believe will result in an increase in denials, which is contrary to the intent of the legislation. I think it's really important for the committee and for the legislature to note that there are only 3 insurance carriers in Connecticut currently in both the individual and small group fully insured market. It puts the state and consumers in a pretty precarious situation that argues against measures, whether well-intentioned or not, or laudable or not, that could have the unintentional consequence of driving the remaining insurers out of the market. Of particular concern in Senate Bill 3 is the work group that calls for the design and, more importantly, the implementation of undefined affordable health care programs, as well as a new subsidy structure that goes along with that, that deviates from the subsidy structure that the legislature and the administration just passed and implemented. that is something that the association did support in its development. I'm also would like to talk a little bit about the some of the definitions in Senate Bill 3, one which speaks to other persons, which while I could read the bill in one way to be targeted to specific populations and specific poverty levels, not otherwise currently covered by the exchange or covered Connecticut, I could also read it as kind of taking over covered Connecticut and expanding it by virtue of the term other persons to a much broader category of people. So that is a significant concern for us as well. And the prior authorization provisions, as I said in my initial statement, by reducing the time frame from 7 days, summarize already? Okay, wow, that was really quick. Okay, I'm happy to answer any questions. How's that for summary?
That's great. Thank you. I don't see, oh, yep, Senator Lesser, go right ahead.
Yeah, thank you, Susan. I appreciate your testimony and your concerns, and I just would ask that you continue to work with us on some of those elements. I'm assuming with your comments though about the basic health plan, unless you don't necessarily oppose a basic health plan, but you have questions about the transition and making sure that we're working with your members on a transition, that we're not just jettisoning covered Connecticut, but we're having a thoughtful transition plan if one is appropriate. Am I putting words in your mouth that are accurate, or I just want to make sure I understand your position?
No, I think your comments are accurate. I think what we think the state should pursue is flexibility of whether or not to pursue a basic health plan, because I think some of the testimony earlier in the day confirmed what I was thinking might be the intent of this legislation, and I think it was an answer to a question that you posed, Senator Lesser, to somebody that was testifying, is that they would like to see covered Connecticut go away, and that the basic health plan would run on the framework of the current Medicaid program. That's a concern for us for a couple of reasons. Obviously, first we have carriers.
I'm sorry, the hour is late. I just want to make sure. You're not saying that that's something I said, that you're saying that somebody else said that?
Yes, somebody else said that in
Okay,
answer to one of your questions. I'm sorry, you asked a question of, should we kind of go with the 1332 waiver or go with 1331 or continue with the 1115 waiver? And I think the answer from one of the previous folks testifying was they would like to go with just the 1331 waiver and run it on the framework of the Medicaid program, if I understood the answer correctly. And that was one of our concerns going forward for two reasons. One is that currently our members service the Covered Connecticut program under the umbrella of the exchange. And second, we have a concern about any reduced fee schedule that would be associated with the Medicaid program, exacerbating the current cost shift that the commercial carriers pick up as a result of the lower Medicaid payments to those providers. Did that make sense? It's late.
Yes, but I think it's, we would have to just see the rules of the BHP and have some sort of thoughtful conversations about how to best design that. But I understand.
Of course, and we would welcome the opportunity to continue working with all of you.
Okay, and appreciate your testimony, and we'll continue to chat.
Thank you. Thank you all. Good luck.
Thanks. Dr. Thomas Farquhar. Deirdre Murch.
All right, good morning. I'm Deidre. I'm the home care director and one of the vice presidents here at 1199. We now represent 14,000 personal care attendants who provide services for individuals with disabilities, either physical or intellectual. And, to be honest, this is, I think, my 12th year testifying on the issue of PCA payroll. So I'm not just tired because it's 1 a.m. I'm tired because we have discussed this issue with you guys year after year. And I'm sure you're just as tired as we are about hearing about people working and not getting paid for hours worked. In November, there were 5,000 non-payments. Those are DSS's numbers. 5,000 non-payments alone. So about 40% of the workforce was impacted in November. And, you know, today we finally have a settlement that's going to make whole some of those workers, but there are still hundreds that are unpaid, unresolved, including about 150 unresolved grievances from 2025. So going on three and a half months old grievances. And the unfortunate truth is that there's new grievances filed every single day. You know, you've heard many of the stories tonight. You'll hear some more tonight for the intrepid who are still on. I have never, in my 15 years with the union, heard so many stories of PCAs who have become homeless as I have in the past 3 months. I've never heard so many stories of repossessed cars, of mental health crises. It has been just devastating to watch how many lives have been thrown into chaos because of both the decisions of DSS and also because of the errors of GTI. And I've listened to them for the past, 13 hours or whatever it is now, kind of talking about who is at fault here. And the reality from our perspective is that there is responsibility for both parties. Like Allied, we believe GTI can't do the job, or at least has not yet been able to do the job, but they're making a much greater profit to not do that job. The year before they took the contract in Connecticut, they had a net profit of about $34 million. And in 2024, the year they took the contract, they had a net profit of $75 million. So doing PCA payroll certainly hasn't hurt their bottom line. And of course, the unfortunate thing is that the problems are also closer to home with DSS. DSS, as you've heard several people testify, are not yet willing to notify PCAs if consumers face eligibility issues that are going to interrupt their paychecks. I heard Ms. Barnett and Mr. Carmichael saying that that's really standard practice not to notify workers. That's just not true. In Illinois, in Oregon, in Washington, in Massachusetts, many of the provisions that we're seeking to pass in this bill, those are already standard practice there, including notifying workers when there are reductions to a consumer's care plan that are going to impact their ability to get paid.
Can you please sum up?
We saw to the commissioner's credit, she did work with us. She paused the shift from initially it was a shift from annual to monthly budgets, and she paused that shift. And she worked with us on a settlement to get money and back pay to 877 individuals who received it today, coincidentally. But as I said, hundreds remain unresolved. And we still haven't received any of the data we've requested from DSS and GTI routinely for 10 years. So we're asking for you to support Senate Bill 498. Please end this payroll nightmare, not just for the 14,000 caregivers, but for the nearly 10,000 consumers who rely on the services of their PCAs to live independently. Thank you.
Thank you so much. And thank you for keeping us updated and for your continued advocacy. Appreciate it. Cassia Flynn. Okay. Melissa Wilder. Bright Johnson.
Good morning. I'm Bright Johnson, Connecticut Government Relations Director for the American Cancer Society Cancer Action Network. In 2026, it is estimated that approximately 24,000 Connecticut residents will be diagnosed with cancer, while 6,700 will die from the disease. Nationwide, more than 2 million Americans will be diagnosed with cancer this year, and more than 18.5 million Americans living today have a history of cancer. At every education level, individuals with health insurance are more likely than those without it to have access to critical early detection cancer procedures. Having health insurance coverage makes an individual more likely to survive cancer, and the effects of insurance coverage on cancer survival are even more pronounced in disadvantaged communities. In Connecticut, Medicaid provides health insurance for over 900,000 children and adults who don't make enough money to afford healthcare coverage on their own and are not offered coverage through their job. Having access to health coverage is one of the greatest predictors of whether or not someone survives their cancer. Medicaid is a lifeline for cancer patients because it ensures affordable health care for people who become too sick to work. The ACA allowed for significant progress in the fight against cancer and enabled tens of millions of people to access affordable, comprehensive health insurance, many for the first time. Research shows having health insurance is one of the most significant factors in surviving cancer. Access to health coverage results in earlier cancer diagnosis when the disease is more treatable and less costly, and cancer outcomes are improved. Many provisions in H.R. 1 and subsequent rulemaking work against the spirit of the patient protections in the ACA and would roll back years of progress, as well as tie the hands of state legislatures to improve health insurance coverage in their state. The consequences of that bill will be devastating. Americans will live sicker and die sooner. However, states, including Connecticut, have an important role to play in shaping the implementation of H.R. 1, and certain decisions made in the states will significantly affect the ability of patients to prevent, detect, treat, and survive cancer. SB 3 provides sensible choices and solutions to many of the issues leading to higher healthcare costs and fewer future viable options as a result. ACS CAN's mission to end cancer as we know it for everyone. Access to affordable quality healthcare is crucial to achieving that reality. It is vital that comprehensive, affordable access to healthcare coverage remain a lifeline for people with cancer, survivors, and people in need of preventive and screening services. Access to care should be expanded, not limited. Research consistently shows that expanding access to care increases insurance coverage rates among cancer patients and survivors, early stage cancer diagnoses, access to timely cancer treatment, receipt of cancer screenings and preventative services, and survival rates. Thank you for your consideration.
Thank you so much, and thank you for your continued advocacy and for staying here so late with us tonight.
I admire your stamina.
Lots of coffee. All right, have a good one. Beatrice Moncada. John Stakely.
Good morning, Representative Gilchrist, Senator Lesser, and distinguished members of the committee. My name is Jonathan Stakely, and I'm a personal care assistant for my brother Jesse, who has Down syndrome. I'm here today to support Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. Like thousands of individuals across Connecticut with physical and intellectual disabilities, my brother depends on caregivers every single day. On sunny days, he needs care. On rainy days, he needs care. No matter the season or the temperature, his needs they don't change. His safety, health, and dignity rely on consistent, dependable support. And without that care, I worry deeply about what his future will look like. You know, I love my job. I love being able to ensure that my brother's health and well-being are protected. But with the responsibility comes some real challenges. One of the most pressing challenges we face is a payroll system through GT Independence that serves caregivers. And as a delegate in our home care union, I regularly receive calls from workers who have not been paid on time for the hours that they've worked. Some have gone weeks waiting for corrected paychecks, and the added financial stress makes it incredibly difficult for caregivers to pay rent, buy groceries, and maintain stability in their households. We're already facing a workforce shortage, and recruiting and retaining qualified caregivers, especially for individuals like my brother who is nonverbal, requires trust and reliability. It is nearly impossible to ask someone to take on this important work if we cannot guarantee that they'll be paid accurately and on time every time. That includes proper payment when they use their earned paid time off. Unfortunately, caregivers are still not consistently receiving their correct compensation when they use their paid time off. When caregivers are not paid correctly, it does not just impact the workers, it directly impacts the people who depend on them. And my request today is simple. Please pass Senate Bill 498 to ensure that caregivers across our state are paid in full, accurately, and on time every time. A stable fiscal intermediary means stability for caregivers, and stability for caregivers means safety and dignity for people like my brother. So thank you for your time and your consideration.
Thank you so much for the work you do and for being here and to advocate tonight.
Thank you.
Okay, we're gonna rattle off some names. John Brady, Guina Perez, Terry Henning, Michelle Joneless, Nikki Scholes, Arlene Angel, Drew Michael McWeeny, Meg Gorman, Lauren Gardner, Joshua Amoroso, Leah Palagashvili, Harold Kritzman, Brian Donahue, John Kissel's not here, Barbara Lehman, Paul Boudreau, John Satterfield, okay, Ellen Andrews, Esteban Calderon, Gabriel Gambardella, Mally Callahan, Latia Maldonado, Tiffany Glasser, Philip Schenkman, Juan Gavidia, Sarah Egan, Pearl Granite, Jashelle Johnson, Chris Moore, Nick Carapasas. Go right ahead.
Well, good morning, distinguished members of the committee. My name is Dr. Nick Karapasas. I'm a chiropractor practicing in Manchester, and I serve as president of the Connecticut Chiropractic Physicians Association. I'm here to speak in support of SB 499. First, I want to say thank you. This committee played a key role in restoring chiropractic medicine fully to the Medicaid program. Without your work, that wouldn't have happened. Before that, we were only covered to treat children who were referred to us through the EPSDT program. Your actions made a real difference for patients. In my private practice and at FQHC in Enfield, I do my best to care for patients who are part of underserved populations, and that includes those of us who are on Medicaid. You know better than anyone, and you've heard it over and over again, that reimbursements that we're receiving for services in Medicaid are terribly low and cover a fraction of office overhead per patient. For chiropractic, I want to give you some concrete examples. Out of all the codes for treatment within our scope, Medicaid currently only covers manipulation of the spine and pelvis. Chiropractic billing requires us to report each body region addressed during treatment for spinal manipulation. So for a 1 to 2 region spinal manipulation, let's say treating the neck and low back, Husky Medicaid reimburses $15.12. For a 3 to 4 region spinal manipulation, so somebody who has a problem with their neck and their back and their pelvis, $20.72. So Medicaid is paying roughly half of Medicare for the exact same medically necessary service and a small fraction of average allowable rates for major medical. If Medicaid rates were brought up to 75% of Medicare, we'd increase to about $20.98 for the 1 to 2 region and $30.08 for the 3 to 4. That's far more realistic than what we're getting paid today, and it would make a meaningful difference to whether or not providers can keep seeing these patients. We should close that gap, as you know, under SB 499 within 3 years. Right now, it's virtually impossible to operate a practice that's dominated by Title 19 patients with fees at these levels. As you well know, inadequate reimbursement inevitably hurts patient access through multiple compounding mechanisms. Chiropractic care is non-invasive, it's evidence-based, and opioid-free. We consistently achieve excellent results for our patients with high patient satisfaction scores. We also reduce the risk of addiction in patients who are experiencing serious pain and might otherwise be steered towards opioid use. Our treatments are conservative in nature, and for that reason, we also support Section 13 of House Bill 5561, which encourages the use of non-narcotic pain treatments in Medicaid. Your committee has always supported Medicaid patients and the providers who care for them. We know that, and we know you'll continue to do your best this year. We're honored to serve these patients. Senate Bill 499 is a solid step in that direction. We strongly support it. Thanks for the opportunity to testify. Thanks for everything you guys do and hanging in there, and I'm happy to take any questions you guys have.
Thank you so much. Representative Comey, go right ahead.
Please.
Thank you, Madam Chair. Hello, Doctor.
Hi.
I was wondering if you would be able to explain the cost effectiveness of the the no narcotic treatment of pain.
Okay, so there's lots of layers to it. The first door that patients walk through determines how much it's going to cost us, and it's going to cost the state. The data we have shows that when patients start with seeing a chiropractic physician, the total bill goes down. So we're seeing fewer unnecessary advanced imaging like MRIs or CT scans, fewer ER visits, and fewer surgeries. On top of that, the most practical tool we have to avoid opioid prescriptions is preventing that first prescription from happening. We know that patients who see a chiropractor for spine pain are significantly less likely to end up on opioids in the first place or to suffer from long-term dependency. They're also less likely to end up on an operating table because they're getting care before the problem spirals. We have a 2024 systematic review that goes over all of that. I can get that to you if you're interested. There are layers of it in terms of data and studies. I'm looking at something that we had that we're reducing overall treatment costs for low back pain by up to 40% and reducing opioid prescriptions by 56%. I can go on and on, but it's late at this hour, and I don't want to hold you guys up. It's my world and passion, and it's how I'm engaged. So happy to help any way I can to get that message across.
Thank you very much. I appreciate you coming out
Thank you.
with us.
I appreciate you guys hanging in there too.
Thank you so much. Have a
Great.
great rest of
Good night.
your night. All right. Christy Koval. Dominic Cotton. Dominic, if you're there, just unmute, please. All right, Dominic.
You might have fallen asleep.
He's been texting, but I'm going to keep going and then we'll come back to you. Sarah Mervine, Sally Grossman, Georgina Fuentes, Ann Olson, Joelle Fishman.
I appreciate you, members of the Human Services Committee, very, very much. My name is Joelle Fishman. I live in New Haven. I'm speaking on behalf of the Connecticut Communist Party in support of SB 3, SB 497, SB 489, as part of the Stand Up Connecticut agenda of Connecticut for All and the Health Justice Now Coalition. And what I'd like to do is focus on payment for home care workers from my personal experience. My mother, Edie Fishman, passed away in 2024 at age 103. And in her last years, she required full-time assistance due to macular degeneration. And we were so fortunate to have the care of a group of wonderful PCAs from Ghana who became extended family, and I shared this testimony with them, so they're part of it. If one or another could not make it to their regular shift, they covered for each other, and Edie was never left alone. At that time, the fiscal intermediary was Allied Community Resources, and it was a nightmare. The caregivers were constantly shorted in their pay and had to take time, sometimes hours, right on the job to try and get through on the phone to inform the agency. And the union tried to help. In the end, ED's PCAs were never fully compensated for the labor they put in. And shortly before my mother passed away, Allied was dropped by the state, and the current fiscal intermediary, GTI, took over. And at that time, we celebrated. So I was horrified to learn that the same thing is happening all over again with GTI. Workers not being paid while GTI doubles their profits. It's just completely unacceptable. In the end, the state of Connecticut is ultimately responsible to make sure if workers put in hours, they're fully compensated. Otherwise, we're talking about slavery. How can it be that hardworking caregivers are losing their housing because the paycheck didn't come in? But that is the reality. I support SB 498 that establishes important safeguards, and I especially support transferring fiscal intermediary duties from a private for-profit contractor to the public sector. Home care workers and patients will be much better served if the state of Connecticut handles the pay instead of a for-profit private intermediary. It would mean more jobs for state workers and more accountability. Passing SB 498 is a necessary response to an emergency situation that just can't continue to exist. And I also want to speak in support of SB 3, establishing the Connecticut Option Affordable Healthcare Program is a concrete step that goes in the direction of making healthcare as a human right into a reality. Federal cuts to healthcare are cruel and unconscionable. It's up to our state to stand up and take action to protect our families and communities. If I'm running out of time, I'll go to the end. The Connecticut option is also a concrete step toward addressing the widening wealth and racial gap in our state. This is the moment for us to step forward in Connecticut and enact measures like SB 3 that benefit the health and welfare of all of us and our communities. And I thank you very much.
Thank you very much. Thank you for your testimony and for being here this evening. Dominic Cotton.
I think I'm on here now. Whoops. My apologies.
All right, we got you. Go right ahead.
Recording in progress.
All right. Sorry, my name's Dominic Cotton. I'm here as representative working with 1199, who's my union. I've been working on waiver programs for the past 26 years as a private provider.
Dominic, I think you're on twice.
All right, how do I do this? Am I all right?
Turn off
No,
the
it's okay.
All right. I'm not sure which one I'm on.
Well, it is. Blaming you. All right, let's see if this works. Try again.
Am I still here?
Yep, and there's no echo. Go right ahead. Dominic. Uh-oh, we lost him again. Oh, there you are.
All right. Am I here?
Yes, go for it.
I'm hoping I'm here. If I'm not, then I guess it's a different problem. So I'm here with 1199 tonight. Obviously, I've worked on this program for the past 26 years as a private provider, as an agency provider, as also working as I used to run all of Goodwill's programs a multitude of years ago. I guess my issue tonight is SB 498. I've taken the opportunity to have conversations with Christine Weston as well as with the commissioner over this issue. I kind of brought them to light that there was a problem when they switched over from an annual contract where you might go over on certain months and you would be under hours on the next month. Whereas due to the federal government, they switched over to a monthly limitation. Unfortunately, because of this, back in October, with the way that the days fell in the month, the majority of the extra days beyond the 28 days happened on a Wednesday, Thursday, and Friday when a large majority of people received their services. And because of the situation and a multitude of other problems that they had, people went over hours without knowing that DSS had actually changed over to a different way of calculating their hours. So I brought this to their attention back at the beginning of November when I could see that this was going to be a problem for myself and one of the clients that I work with as we went over hours for the month. I think I left in my testimony a long explanation of what some of the issues are that are ongoing with the Department of Social Services. I appreciate that the commissioner has worked very closely to try to fix a lot of these things. The difficulty that I have specifically is it's usually after the fact that we find out that there's a problem, that they tend to jump in instead of telling us beforehand that they're making changes within the system. Obviously, there's been issues with GTI, much as there was issues with Allied prior to that. The whole program is set up as a retrospective payment system instead of a prospective payment system, which I brought to their attention. I know I use the Sandata system because I also own an agency, which I provide a service for people under the brain injury waiver, which doesn't allow you to be able to go over hours in a particular month because it asks you to enter in that information ahead of time. Whereas the system that you have with GTI is retrospective. I know they've made some corrections to their budgeting system, but I feel like the system itself is far too complicated for a general person to be able to understand how to utilize. And it leads to a lot of complications. And because of this, and because they don't really tell you when somebody's services have either due to them not doing their renewals might have ended, it ends up where people don't get paid for their services. So I let the commissioner know on opening day that I was perfectly willing to work with her to help test their systems to try to figure out a better way to work with this. I would be in favor of more oversight of them because
Dominic, can you wrap it up?
It's usually afterwards that they come to understand that there's a problem rather than prior to,
Great. Thank you.
if that's helpful.
Yeah. Okay.
Did
All
we
right.
catch all that?
Yeah. Maybe mute him at this point. Thank you. Thank you so much. Sarah Mervine. Oh, I already did all those. Nope. Going to Maria Coton Skinner. Diana Martinez. Gary Turco's not here. Frank Vichy. John Kearney. Terrell Williams. Kara O'Dwyer.
Good morning,
Good morning.
Senator Lesser, Representative Gilchrist, and honorable members of the Human Services Committee. My name is Kara Osweier. I'm a personal care attendant, and I'm here to ask you to pass Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. At this point, it is up to you to address the crisis happening with GT Independence, especially when it comes to PCAs being paid properly and on time. I have been a PCA for over 11 years and for almost 9 years with Allied Community Resources, and the last over 2 years with GT Independence has been a nightmare. In October, I became homeless for the second time. The first time was with Allied when my parents' home got foreclosed on, partly due to unpredictable payments from the fiscal intermediaries that make it so that we get paid for the services we provide to the most vulnerable people in our state. For the past over 4 months, hundreds of PCAs have been fighting to be paid for hours we worked. In some cases, it was just a few hours. Others are completely missing entire weeks of pay. This is unacceptable. That's slavery when you work and you're not paid. We're already working for poverty wages, struggling to piece together hours of work. And when we're paid partially, late, or not at all, it puts us into desperate spaces. It makes us hungry, lacking medical care, homeless. How are we supposed to provide the care that our clients deserve when we can't even take care of our own selves? This is a failure on behalf of the state of Connecticut, and I was so hopeful that GT Independence would be different. And in a lot of ways, they were. I used to get paid on Thursdays, a day early, and that was great. But issues with PTO being paid at a lesser rate, paychecks not showing up, bills are late, you get late fees, overdraft fees. It's expensive to be in poverty. And we don't deserve it. Neither do the people we serve. And this needs to be fixed long ago. We don't deserve this. Thank you for your time.
Thank you for your time, and thank you for staying up with us. Truly appreciate you being here.
Of course.
Tashiana O'Connor, Howard Sellinger, Junior Warden Denise Welsh.
Good morning, Senator Lesser, Representative Gilchrist, and distinguished members of the Human Services Committee. My name is Denise Welsh. I'm a junior warden at St. Martin's Episcopal Church here in Hartford. Today and always, I will stand by and in support of our personal care attendants, PCAs. And so I'm happy to put my support behind Senate Bill 498, an act protecting paychecks for personal care attendants and expanding public access to state programs. And I urge you, each and every one of you, to do the same. As a member of the increasing numbers of seniors and retirees in our state that will not only need but depend on the service of PCAs offers us, I know the value of what they provide. Its dignity, its comfort, its never feeling alone. Their services are nothing new. We have had home care in one form or another for decades. Yet here we are in 2026, they're still fighting for respect, recognition, and livable wages to be paid on time. How is this even possible? It is time for Connecticut to acknowledge the importance of PCAs in our society. It is time to compensate them for the job that they do that allows those in their care to live dignified and support in their own homes. The PCA brings them compassion, safety, keep them healthy, and fill a void of loneliness at times. Yet, at the same time, the PCAs are often unseen, forgotten, or undervalued. A family member of my own church, a woman in her 80s, is committed to caring for her brother at an age when she should be getting ready to retire, slow down. She has no plans of doing that. Instead, she shows up for him every single day. These caregivers need you, the elected officials of our state, to stand by them too. Show them the respect they deserve. It is as simple as making sure all communications for and to the PCAs are improved so they know when there is an issue in a timely manner instead of waiting for a missed paycheck. I'm begging you, I'm beseeching you. It's time for you to support and make sure that caregivers are being paid accurately and on time every single time. That change starts today with your support of SB 498 and showing the PCAs they do matter and you do care. Again, on behalf of the members of my church and everyone in earshot, please let us show them the love. Let us give them the respect. Let us give them that livable wage that is always paid on time and is always accurate. Again, thank you for all that you do, and may God continue to bless and give you the strength to do the work. But it is time, and they do need you. They need you to support them very much. Their families need you.
Thank you for your
Thanks again, and of that, Bill.
Have a great evening. Thank you for being here.
You too.
James Norkowish, Stephen Owen, Lilliard Lewis, Cynthia Jennings, Ed Hawthorne, Joseph Pandolfo, Sue Prehar, Tom Swan.
Good morning, all. My name's Tom Swan. I'm the Executive Director of the Connecticut Citizen Action Group. On behalf of our member families, I want to really thank you all for the time you put in and the dedication all of you are showing to listening to people with some really powerful stories and some really big needs. It's really important, but I know it's not easy. I've been on this listening for hours, and you guys do this all the time. So thank you. CCG is also a founding member of Health Justice Now. That's a coalition that came together this year to really push us to go to additional levels in terms of healthcare reform. And I think during a short legislative session, I want to commend you as a committee for stepping up to meet the moment and also set the table for some of the stuff that we all know are coming down the pike. The legislature and the governor in special session created the emergency fund that helped to blunt some of the worst aspects of Trump's H.R. 1, but that bill is going to continue to be with us. Many of the worst parts of that bill are going to kick in after the elections because the authors of that knew how unpopular it was. So many of the worst changes to Medicaid in Connecticut, what's going to happen to the people who we got subsidies for this year, but at the end of the year coming down the pike, there's a bunch of things that are going to happen. I mean, the Rand Corporation announced in a study recently that they expect over 114,000 people will lose Medicaid. On top of that, we're going to see tens of thousands of people lose and another tens of thousands of people having food assistance get cut at a time when the cost of food is going to be going through the roof because of this foolish war that we've been engaged in Iran. And I think we might need to push through some additional revenue or funds from the emergency funds to meet that in the long term. My coworkers, I think, mentioned testifying on a number of bills. I just want to voice our strong support for Senate Bill 3 and Senate Bill 497 today. And also, I got to give a shout out to the paying of the PCAs after the last couple of testimonies are resonating with me. In Connecticut, no one should lose their health care and nobody should go to bed hungry. We're the richest state in the country and the richest country in the world. The top 25% of taxpayers in Connecticut are going to be getting a tax cut of $3.4 billion every year over the next 5 years from the Trump redistribution of wealth upwards bill that was passed by Congress. This is real numbers. What you're talking about with your bills here are a small fraction of that 3.4 billion. I'm happy to do it. The crisis is escalating. We know that what's coming down the pike is going to be really bad. Thank you for doing what you're doing. I say it up just to express my appreciation, not to keep you up later. Thank you.
Thank you for all you do, and thanks for being here with us. All right. Allison Weir, Maribel Rodriguez, Jennifer Chadukut, I'm not going to even try, Anthony Pearson Delizia, Jill Ricard, Jenny Cornejo, Caprice Saunders, Jennifer Fiorillo, Samuel Saylor.
Hello. Wow. I've been listening all day. I was at the Capitol when the commissioner spoke very eloquently. And anyway, let me get here because I need to go to bed. I got a funeral to do in the morning. My name is Pastor Sam Saylor. I'm with the Faith and Power Assembly in Hartford, Connecticut, cohort of pastors representing the social justice and working on healthcare disparities and issues. I'm here to speak on Senate Bill 498, which you've heard a lot about today, protecting the paychecks of personal care attendants and expanding public access to state programs. And I'm a skip the salutations to take my 2 minutes. You know who you are, Gilchrist and Senator Lesser. Listen to you all day. Your passion and commitment seems as real as the commissioners. You've heard the passion of people beg you for you to do the right thing. I'm here. Again, my name is Sam Saylor, and my relevant reason for speaking before you today is predicated on the belief that I hold regarding the value of citizenship, my humanity, and the theology of being my brothers and sisters' keeper. Because of that, I sit here today at this late hour in the morning, saying, please put your support behind Senate Bill 498. I'm saying it is your absolute responsibility. to do so, and an act of protecting the personal paychecks. As a witness to testimony of these individuals, there are individuals, they're real human beings, they're living, breathing human beings that do a job that we really don't want to do. While we sleep at night and have our parties and have our celebrations, they are putting in the time and the work to keep the dignity of a living individual alive and the hope alive in their life. And they deserve our attention, our duteous attention. Time is so precious, and I value our time at this very moment to gather for the reason together, gather together and reason together for a better Connecticut. I hope for a better Connecticut is a song worth singing, but I cannot sing that song based on the current realities of the grievous, burdensome, and dangerous survival conditions within the segment of our society, state, and homes, namely those personal care assistants. I'm speaking on the working conditions of the personal care attendants that you've heard so diligently expressed to you, Dave, so sincerely expressed to you, Dave. And being on these mics at this time of night, I know you have a compassion to hear. This is more than a duty for you. This is your lifestyle to listen to the people and respond to them. And so I'm speaking on that issue today because we have a moral responsibility to do something seriously about it. We heard from the third-party contractor, all the issues that were going on, all that stuff, from what I understand, all kept ringing in my head was everything is fixable. Everything is fixable if we really want to fix it. We pride ourselves in our state motto, with our state motto called the Constitution State. When speaking of the motto, it should mean that we are more than a piece of paper. It's more than just a quick comment or a rehearsal of what could be, but rather what should be. It should speak to the character of our values. And I dare say our values must speak to the worth of our citizens, those that we send to work, do the jobs that we don't want to do. Sadly, we are not standing on the value Constitution on our valued Constitution regarding the conditions of personal care attendants. Please let me elaborate. Our valued PCAs are people too. They are parents, taxpayers, consumers, voters, patients, drivers, church members, sponsors, nonprofit organizations, and of their respective communities. They have heavenly and seemingly invisible lifting the standard of dignity requisite to an engagement of their consumers, for their consumers to live on despite the struggles presented in their lives. Our PCAs deserve us to deal with this issue as diligently and as fast as we can to bring dignity back to the life that they're doing. And I'll close with this concern. This song that you've probably heard from the wonderful Tina Turner. We need a little bit more respect. We need a little bit more respect for those people who are doing such a delicate and wonderful job and not getting paid or not getting paid on time, because the bills don't end, and the light companies doesn't wait, and the gas companies doesn't wait, and the food bill doesn't wait. And so we need to have a little bit more respect, a little bit more understanding of this delicate role that we're asking people to play while we go on and live the life that we want to live. Please spend some more concern and do some due diligence. We thank you for spending the night with us tonight and hearing us all tonight. Amen. Have a great night.
Thank you so much. Kristen Ferguson. All right. That concludes the Human Services public hearing. Thank you, everyone, for being here, and thank you to the staff.
Especially.
Amen.